Hello, fellow classmates. The following presentation is focused on spinal stenosis. This presentation will be presented to you by Tanya, Lily, Mike, Vera, and myself, Svetlana. The focus of our presentation will be based off the following case study. John Arm is a 55-year-old male who lives with his wife, Christy. He has been employed as a welder for the past 15 years and self-admittedly leads a pretty sedentary lifestyle with no other known comorbidities. 5 years ago, John Arm started experiencing lower back pain that would radiate to his left thigh and calf. After having an MRI scan performed, he was diagnosed with lumbar spinal stenosis. According to the MRI findings, it was noted that there was moderate to severe spinal stenosis between L4 and 5 due to a subligamentous herniation. Between L1 and 5, it was also noticed that he has moderate osteoarthritis, which is the cause of his lumbar spinal stenosis. Due to the severity of his symptoms at the time, a lumbar laminectomy was scheduled on L4 and 5. Unfortunately, after surgery, he was diagnosed with lumbar post-laminectomy syndrome because his symptoms have not improved with surgery. With this diagnosis, Mr. Arm continues to have mobility issues and chronic pain of the lower back and legs. Due to his chronic pain, he has decided to change his occupation and is currently working at a less intense labor environment. Mr. Arm's chronic pain is aggravated with prolonged walking or standing. As a result, he requires frequent resting periods. His primary provider prescribed him with pain medications and referral for physical therapy with at-home exercises.
As a person ages, they undergo degenerative changes in the spine. Some of the changes are from thickening and or bulking of the ligamentum flavum, osteophyte formation, facet hypertrophy, and intervertebral disc bulging. As a result, the spinal column narrows and spinal nerves are compressed. This could result in neurogenic claudation or even compression-induced ischemia of the cauda equina. John Arm first experienced neurogenic claudation symptoms and later had cauda equina syndrome. A consequence of spinal stenosis is pain that radiates to lower extremities and buttocks. With standing and ambulation, the pain worsens. This can lead to decreased mobility and a sedentary lifestyle. A person may have decreased performance of self-care activities. With inactivity, the person may be at risk for developing several chronic diseases such as obesity, metabolic syndrome, heart disease, type 2 diabetes, and some cancers. Due to spinal stenosis, John was not able to walk for more than 20 minutes before he needed to rest. This also affected his job and he had to seek other employment. Although John already had a sedentary lifestyle, this further debilitated him from physical activity. Age is the most common cause of spinal stenosis. There is no evidence that supports spinal stenosis linked to race, gender, occupation, or body type. Bone condition such as osteoarthritis is a degenerative bone disease that may lead to spinal stenosis. Spinal stenosis cannot be prevented, but inactivity, poor diet, and a body mass index of 24 to 30 increases the degenerative process. Although older adults are usually affected, the younger population may also get spinal stenosis. Risk factors include congenital spinal cord deformities such as spinal dysplasism, segmentation failure, achondroplasia, and osteoporosis. John's primary risk factors include age, inactivity, and spur formation from osteoarthritis.
The diagnosis of spinal stenosis is not fully preventable. As the main known cause of spinal stenosis is aging, we are not able to prevent aging from occurring. However, studies have found that there are several ways people are able to extend the health of their spine. The first preventative measure is exercise. The benefit of proper exercise is that it strengthens and provides flexibility of the spine, joints, and ligaments that helps in protecting the spine from everyday wear and tear. In addition, it will strengthen the abdominal core muscles and limbs, resulting in the relief of extra stress from the back. Exercising also helps with maintaining a healthy body weight. A combination of aerobic, weight training, and stretching is the best combination to perform for about 30 minutes a day It is advised that when starting an exercise program, to first consult with your primary doctor. The second key point in preventing or delaying the start of spinal stenosis symptoms is proper body mechanics. With proper body mechanics for standing, sitting, lifting, sleeping, and in every aspect of life is important for relieving pressure from the back and preventing injury. Lastly, maintaining a healthy weight also helps with keeping extra stress from the spine and joints. As mentioned before, aging is the primary cause of spinal stenosis. As a result, we are not able to prevent aging, but that does not mean that people are not able to be proactive about the health of their spine. A combination of the three healthy habits against spinal stenosis provides a strong defense system for years to come.
Nursing assessment. Physical findings. Lumbar spinal stenosis is typically in the lower lumbar spine involving the compression of nerves that can cause pain or cramping in the legs when standing for long periods of time or when walking. The discomfort usually eases by bending forward or sitting down. The patient may complain frequently of radiating leg pain with numbness and paresthesia in the involved dermatomes. Muscle weakness may be present in muscles supplied by that nerve root. Myelopathy is a spinal cord dysfunction and it may or may not be present with LSS. Signs and symptoms of myelopathy are only present if severe enough or centrally located on the spine. These include finger numbness, clumsiness, difficulty walking, spasticity, and loss of position sense. If the condition worsens, the patient develops more symptoms, which include bowel and bladder control dysfunction, hyperreflexia, positive Hoffman sign, positive Babinski sign, and/or clonus upon examination. Relating back to John Arm, he had complained of lower back pain that would radiate to his left thigh and calf, which would exacerbate with prolonged standing and ambulation. He would need long periods of rest between activity. He described his pain as sharp and shooting with a burning sensation, indicating paresthesia. Spinal stenosis may be difficult to diagnose because the signs and symptoms resemble age-related changes. Some tests that may help confirm the diagnosis include MRI, X-ray, CT myelogram, bone scan. Relating back to John Arm, he had multiple MRI scans performed yearly, and then the doctor informed him that he has lumbar spinal stenosis.
The goal of secondary prevention is decreasing the progression rate of spinal stenosis and extending a greater quality of life. In doing so, Mr. Arm would be able to benefit from a chiropractor with minor spinal adjustments to help relieve pressure from the spinal cord. With physical therapy, Mr. Arm would be able to strengthen his core muscles as well as learning new techniques of proper body mechanics and decreasing extensive straining on the back. In addition to physical therapy, he would also benefit from home exercises. It is important to remember that keeping a healthy body weight will help prevent extra straining on the lower back.
Managing spinal stenosis can be difficult for both the patient and medical professionals. In order to provide optimum treatment, the participation of a multidisciplinary team is required. A chiropractor can reduce pain by using distraction manipulation. It is done by having the client in a prone position and performing specific movements and maneuvers. Researchers state that it will decrease intradiscal pressure and create vertebral motions and increase the intravertebral foramen. Researchers have found that performing aquatic exercises in water is beneficial for decreasing tension and increasing muscle strength. For people with suffering from spinal stenosis, the density of the water makes it easier to perform the exercise. Overall, both conventional and aquatic physical therapy plays a key role in reducing and managing lower back pain. Physical therapy includes applications of hot packs and TENS for 20 minutes to the lumbar region, has been suggested to be effective and could provide significant improvement in pain and functional parameters in LSS patients up to 6 months of follow-up. John Arm was referred by his doctor for physical therapy and at-home exercises. Back to school is to educate the patient on body posture improvement. Complementary and alternative therapies, which include biofeedback, acupuncture, and yoga. Collaborative pain management. So pharmacology would include mild analgesics such as nonsteroidal anti-inflammatory drugs for pain and stiffness, antidepressants for pain relief and sleep issues, gabapentin also known as Neurontin for nerve pain. John Arm's doctor prescribed him with pharmacological pain management. Another one is local heat or cold application. Also, minimally invasive treatments may be implanted if the patient's pain does not subside with usual therapeutic treatments as previously listed. And these would include epidural corticosteroid injections or implanted devices to deliver pain medications. If the pain continues to be severe, the patient is considered for surgery.
The nursing interventions and desired outcomes for John. The main goal is going to be to decrease, prevent pain, and maintain his function. With pain management, we can educate him on his prescribed medications. NSAIDs may reduce pain and inflammation. Muscle relaxants can calm muscle spasms. Antidepressants may help with pain relief and sleep problems. Anti-seizure medications are often used to reduce nerve pain, improving walking. Educate him on the non-medication interventions like hot and cold therapy, distraction, relaxation, the use of a TENS device, the use of bracing or a corset, acupuncture, and massage. And then some other things that are used for treatment include corticosteroid injections, epidurals, or an implanted device such as a pain pump. We're going to advise the patient to keep activity within his comfort level. If he needs to sit or rest when necessary, do that. Just a few minutes typically enable him to continue with his activity. Educate him on proper sleeping positions. Have him avoid sleeping in the prone position as it puts excessive stress on the lower back. The patient should sleep supine with a 10-inch pillow under his knees to keep his hips and knees flexed, or in a side lying position with his knees and hips bent. As far as health and mobility promotion, we're going to assess his body mechanics and educate him on proper techniques. Refer to physical therapy as this can minimize pain and reduce further episodes. Educate on the importance of weight control. Excessive weight can add to stress on the lower back and weaken abdominal muscles necessary for back support. Educate on the importance of remaining active. Often patients become less active to reduce pain, but this commonly leads to muscle weakness and more pain. Assist or collaborate to develop an exercise plan for John. Incorporate stretching and strength training to maintain or improve mobility. Coping. We're going to seek to understand his perception of the situation. This will allow us to promote a positive strategy to deal with any limitations or needed lifestyle changes. And then we're going to develop a plan of care that involves goal attainment, as this can promote hope for John and keep him engaged and compliant with his plan of care.
The three major interrelated concepts for Mr. Arm's spinal stenosis are pain, fatigue, and elimination. Mr. Arm has a history of a herniated disc and osteoarthritis, which contribute to the concept of pain. When the cartilage wears out, bone spurs, also known as bone projections, grow on the edges of the bone. This new growth starts to press on the spinal cord, thus creating spinal stenosis. In Mr. Arm's scenario, a herniated disc contributed to the worsening of his spinal stenosis by causing an increased narrowing of the spinal canal by the bulging disc. As a result, the nerves become severely pinched between the vertebra and herniated disc. Fortunately, his herniated disc problem was resolved with surgery 5 years ago.
However, the outcome of the surgery was not successful in treating his symptoms of lower back and leg pain. As a result, he was diagnosed with lumbar post-laminectomy syndrome. Over the next 5 years, Mr. Arm's osteoarthritis of the spine continued to worsen and increase in the amount of pain that it causes. Due to his condition of osteoarthritis of the spine and the negative outcome of the spinal surgery, Mr. Arm will have to live with chronic pain. Long-distance walking combined with frequent movement contributes to Mr. Arm's level of fatigue. Mr. Arm is required to sit or lay down frequently in order to rest his legs and recover before continuing other activities. As a result, this serves as an excuse to continue a sedentary lifestyle. With Mr. Arm's limited activity levels due to fatigue and pain, his mobility over years have decreased. The third interrelated concept is elimination. Mr. Arm has admitted to living a sedentary lifestyle and spending most of his day sitting or laying around on his couch. In addition, during his follow-up visits with his doctor, he admits that he has poor fluid intake and is unable to be as active as before due to pain. When all of these factors are combined, they have a negative effect on the gastrointestinal system, which contributes to his occasional constipation.
Thank you for listening to our presentation. We would love to answer any questions that may have come up in the discussion below.